Today we're going to talk about our engineered prosthetics. So what we don't make here are teeth. What we make here are prosthetics, and prosthetics are pieces of engineering that are there as replacement so-called teeth, but are nothing to do with teeth at all. So the materials that we use are PMMA blocks, as you can see from this. These are discs. These are already pre-made, and we also use titanium. So they're solid. They're not powders or, we're not sitting around casting stuff or making it in a pottery shed. These are designed to be milled on medical grade milling machines that work to very high tolerances of accuracy. And what they produce is the following. So from the titanium disc, we produce a titanium bar. And from the PMMA disc, we produce what we call the veneer. The two parts are designed to fit perfectly together, like this. So as you can see, the two parts are custom made for every individual person, and they are bonded together, and each one has a different function. So let's start with the titanium bar. The titanium bar itself is screwed onto the implant heads, which are here, as you can see. Okay, and you can see that the fitting surface, the bit that fits against the gum, is a highly polished surface. For us, it's the most hygienic surface you can possibly create against soft tissue, and that's really important to us because to a great extent, it's self-maintaining because it's the smoothest surface we can create. The other side is roughened up on purpose, so when we bond the PMMA to it, it's a very strong bond. And this is before bonding and finishing. By the time it's bonded and finished, it will be super homogeneous and very easy to maintain. This part is the part that sits against the gum, and this obviously is the tooth part that you'll see in your mouth. And then obviously we paint on the pink part, and we ensure that your lip sits around there somewhere. So nobody actually can tell the difference as to whether it's teeth or prosthetics. But as far as you, the patient, and us, the clinicians, are concerned, you are in a prosthetic state. The veneer itself is designed with several things in mind. One of them is it's incredibly light, but it's also more than strong enough to do normal chewing. So you should be able to bite an apple, you should be able to eat a steak. What it can't do is crack beer bottles open with your teeth, or chew ice cubes, or eat solid pieces of chocolate straight out of the freezer, because you shouldn't be doing that with your own teeth anyway. And unlike natural teeth, which, as we've discussed in other videos, sit in an elastic pocket called the periodontal ligament, which acts as the shock absorber, implants have no shock absorbers. So in all engineering, we have to reproduce the shock absorber, and we reproduce that with this material, which is the PMMA, which is exactly why we do not and will not use zirconia or ceramics or any of these hard stroke brittle materials, because they don't act as the fail-safes we want. Because what we don't want to happen is we don't want any damage to the implants in the jawbone, because that will require surgery. Whereas if you break a prosthetic, and that is the reality, people will break prosthetics, we just can't predict when, but it's usually when they're not thinking. It's actually very easy to just replace this part, because it's virtually unheard of that anyone manages to break the actual titanium bar, because it's a solid piece of metal, okay? And once the two bits go together and they act as one, they sit with comfort. And also we can see the internal dimensions of it. As you can see, there are holes through the bar and there are holes through the veneer. And when the two parts are mated together, the holes line up and we screw it on through these holes, and these fit onto the heads of your implants, and the polished surface sits very lightly against your gum tissue. So we use titanium and PMMA. Okay, we don't use any other materials. Yes, there are other clinics out there that will talk about ceramics or zirconia being better. Better is really a question of what are the compromises you are prepared to accept. So better aesthetics, not necessarily so, but harder overall material, which could be detrimental to the implant in the long run. in my view, isn't a compromise that I'm prepared to accept for our patients, because what we're interested in is optimal longevity. How long can things last without needing surgical intervention again is our idea of success. And how do we actually create these? Well, we actually design them. So all of it is based, again, on individual anatomy. We know where your implants are. We know their exact measured positions in 3D. And based on that, we will design the bars accordingly, which is the bar design. So we know what the design of the bar is. And we now send this design off to our metal milling machine, which makes that out of the titanium discs I showed you before. And then once we've got that, we then make the part that goes on top of this, which is the veneer, which is this part, which is this part. So they come out as engineered products. And as you can see, the two bits go together. And then we put it all together. And then we do our final quality checks before we deliver it to you. The other major advantage that we have is when people have had a misaligned bite for a very long time, and we need to calibrate chair side, make small adjustments so everything fits just so, it's actually very easy to do it with this material. It's much harder and much more destructive to do it with ceramic-based materials or zirconia-based materials, because once you damage the outer glaze, then you're actually exposing the porous inside of the material. So a classic example is a chipped dinner plate. So a dinner plate has a lovely smooth surface. That's the glaze, the fired glaze. Once it chips, you will notice that the area that's chipped is porous. And that is what's going to absorb oral fluids, which means oral fluids are now going to live inside the prosthesis. This material has very long continuous polymer chains and is non-porous. So we prefer to use this material. And it's also very easy to service, and it's very comfortable for patients to actually wear, and that's why we use it.